the time I'll speak about Lean Six Sigma, brief introduction, about my introduction, about the organization's introduction. And after that, we'll start learning. So thanks a lot once again. And I will just share my screen and give me 1 second. I hope I'm able to see the screen. Yeah. Yeah, so let us start with some few questions, and here are some questions for you, so that I can tailor make my program um, for this audience today. Yeah, and welcome. We have Shahin Shah saying hi. Thank you, Athar. Thank you, Mr. Athar, Shahin Shah. And there are 2 people have responded. So thanks a lot. There are quite a few. So you can keep interacting. I may not be able to see all your comments, but Abdullah Ilnosh, hello, how are you? Okay, you may not be able to see each other's comments, but I'm able to see everyone's comments. So thanks a lot. And let us can you please answer some of the questions? And here are the polls. If you can just start the polls, please. Yeah, I'll just launch the poll. Yeah. So if you can just tell me, beginning poll 3. Okay, sorry. Okay. This was okay. Doesn't matter. Still, we can start with that poll. No issues. Yeah, if you can just answer this question. Yeah, this is the one I wanted you to answer. Yeah. So okay? A lot of people I see are from healthcare and hospital. Oh, okay. Fine. So that's great. By the way, I will repeat it again one more time, but I'm proud to tell you that I have done more than maybe 50 trainings, green belts and black belt trainings for Ministry of Health, and thousands of doctors, nurses, and healthcare professionals in Saudi Arabia have been trained by me. So thanks to see that, good to see that a lot of people are from Saudi Arabia and from healthcare. Okay, manufacturing. I'm a chemical engineer, oil and gas, ADNOC and Aramco and SABIC. They are all my clients. Oman Oil. They are all my clients. Logistics, Otham, Nakel, a lot of clients. IT industry. We ourselves an IT industry. And also, if you can just answer this question, which department you belong to, so that I can tailor make this program. So I see a lot of people from operations, finance, quality, and HR. So it's a mixed HR also. Today, HR professionals are also there. Welcome. So people are from different departments: finance, procurement, also operations, also manufacturing, also healthcare, also. So what I'll do, I'll try to have a balance of examples. I'll give some examples from healthcare. I'll begin with the lean when I'm explaining wastes, etc. When I'm explaining, I'll talk about I'll take some healthcare related examples, and after that, I will talk about some manufacturing related examples. And how deep you want to go into the statistics, you can also tell me. If you are totally new to the subjects, just write in the chat box, I am totally new. And if you have, okay, let's go for the third poll before I continue with my question. So third poll. So can we change the poll? Yes. Okay, so I'm just looking at the, okay, fine. So I can tell you that whatever, if you are in the salary range between up to 5,000, you can easily increase your salary by 3 times to 4 times. And those who are up to, see, a typical black belt, the starting salary is 25,000 real. Okay, 25 to 30. This is the starting salary. And it goes up to 40, 50, 70. And if you are a seasoned consultant, easily you will get 80 to 85, because you will know today why. Today you will know. I'll take a simple example. And while I'm taking a simple example, I'll take a simple example of recruitment cycle time reduction. Recruitment is for every organization. I understand everyone knows what is recruitment cycle. So we'll take a project, and I'll show you, take you through the project, and you will see how any process can be improved using Lean Six Sigma tools and techniques. Okay, next one. Okay, thank you. Thanks for answering these questions. And let me end the poll. So Pallavi is telling I'm totally new. Okay. Shivam is totally new from maintenance. Okay. Melan is logistic control in manufacturing. Okay. I just yesterday visited two warehouses of two different companies. Shellhub is our client, Utham, and a lot of okay supply chain. Ali is telling his supply chain. Okay, Ali Almas is telling I'm also new. Okay, great. Welcome. Don't worry. Momita is telling I'm totally new. Okay, from healthcare and hospital. Are you, Momita? Where are you located? Deepthi is also totally new. Okay. Okay. Sayed Qadri is telling store. Okay. A lot of people from supply chain today. Okay, I'll be happy to show some examples. Anyway, time is limited. I'll rather focus on yellow belt tools and techniques rather than giving you example from healthcare, hospital administration. Tala Kukula is telling. And from Manipal. Okay, Momita, you are from Manipal. Manipal have been conducting a lot of training programs for the last, I think, 10 years. Okay, MHA, you are student of MHA, Deepthi. Okay. Matsidiso is from Riyadh. Right now I'm in Riyadh. I'm a chemical engineer, Dinesh, from Saudi Arabia. Okay, you are from Saudi Arabia. I am a chemical engineer. I think, Dinesh, are you attending our session by any chance? You are the same person who's attending our sessions right now. Okay. MHA, lots of people. Anyway, good. Now I'll stop reading your comments. So great. But keep writing. I will, you know. So I'll keep it very easy because people are from varied backgrounds. So I'll not complicate the matters today. But towards the end, last 15-20 minutes, I'll be little speedily. I'll take you through high-end statistical tools and techniques, which are not related to yellow belt, but I will still tell you what green belt and black belts are capable of doing very quickly. But in the beginning, I will start with the introduction. I'll introduce myself. I'll introduce you to the DMAC, define, measure, analyze, improve, and control. And then after that, applications in the industries, roadmap of implementing Six Sigma. And if time permits, I will discuss some projects from different industries. So I understand many people are from healthcare towards the end. If you are willing to spend half an hour extra, so this is my team can tell how long is the training program today. And based on that, I will add half an hour more. And if you are willing to spend half an hour more, then in that case, so I will maybe if you are willing to stay for half an hour more, I will tell more about some case studies. Okay. About myself, let me tell you about myself and let me welcome you, a formal welcome. Well, I have shaved off my head recently. So the person who you are going to see in the video it's me.
Hi, welcome to Anexas. Anexas has been consulting and training the professionals in the organizations around the world since 2006, and we have trained more than 150,000 people and consulted for more than 500 organizations, which includes Fortune 100 organizations too. I'm Amitabh Saxena, and I have designed this program based on my 30 years of experience while working in various industries across many domains. The whole Anexas team once again joins me in welcoming you.
Okay, so there are more than 30 people behind this training program, as you see today. And on behalf of everyone, I would like to welcome you. We have been around for 18 years and since 2006, and almost all continents, all countries, we have done trainings in the classroom as well as, of course, online. More than 150,000 people trained. I'm a chemical engineer, MBA Finance from Jamnalal Bajaj Institute of Management Studies, and then also an amateur poet. I am very hardworking. I used to work very hard, but suddenly I got to get my black belt certification. I started acting smart. So, when I was in my one of the manufacturing industries, I was working in a petrochemical company back in 1990s. My company declared that they're going to conduct a black belt training sessions for the top 10 performers of the company. I thought I'm one of the top 10 performers, but unfortunately the company did not think so, and I was not trained. But you know, I decided to get the training myself, and I spent some good money. Those days it used to cost a lot, and after spending good money, I became a black belt. After that, I became a master black belt also. Today, I am data scientist, MP, PMP, CPHQ with 34 years of experience. Lots of consulting I have done for many companies, many projects, and spoken in lots of reputed conferences, American Society of Quality, IQPC. I have appeared on TV shows, and also apart from that, I have been into lots of things. Just to show you that I have been doing training programs for the last 20 years. 25 years I have been conducting Lean and Six Sigma training programs around the world. There are some pictures for you around the world. I also take pride in telling that I was the first person to conduct the Lean and Six Sigma Black Belt training program anywhere in Middle East for the first time. It happened in 2007 and 8. And incidentally, that was for hospital, King Khalid Eye Specialist Hospital, but a lot of directors, quality directors from various hospitals had attended that program organized by King Khalid Eye Specialist Hospital, and some group of doctors. They had organized this training. Lots of European clients, American clients, Australian clients. I'm actually a resident of Australia, but I hardly stay in Australia because most of my clients are in Middle East. Right now, I'm in Riyadh at this point of time. Anyone is free to meet me tomorrow in the evening or today also. I'll be happy to meet you again. These are some of the photographs again, some awards, some TV programs. Those who are from India can recognize this
I'm
gentleman.
Shekhar Suman, and I wish to congratulate all the Six Sigma certified black belt from Anexas. All the best.
This was in Z Business Show, which was 13 episodes. He understood from me what exactly means.
On 21st of May 2019,
like this year, I talked about how to reduce nosocomial infections in hospital. One time I talked about oil and gas project. Every year I present one project, Lean Six Sigma project, and I'm invited to those conferences worldwide. Saudi Railways, Indian Railways, American Railways, they are all our clients. It's an honor to have railways as our clients. And anyway, so lots of videos. I have written articles, newspapers, books, etc. Dr. Tarif Alama, Deputy Health Minister of Saudi Arabia, and Dr. Muhammad Abdul Ali, they have all given great credentials to us. I'm not going to play the whole video, but tell you that we have been recommended and approved by lots of people, and our certifications are approved worldwide. If you tell that you have done training, you have got a certification from Anexas, it is highly valuable. Plus, of course, if you tell that you have been trained by me, people will acknowledge it. At least those who know Six Sigma will say that, yes. They will say that at least you have been taught properly. Whether you have understood or not, that's your problem. Just joking. So I'm sure you will understand a lot of things today. So first 1.5 hours, I'll be going easy. I'll be talking about easy tools, not so easy tool. Of course, Lean Six Sigma is not so easy, but I'll try to make it simple. Can you tell me what do you see similar here? What is a common thread running in all these points? A manufacturing company improves production by 30%. A hospital reduces discharge time of patients from 3 hours to 15 minutes. 64% reduction in recruitment cycle time in a multinational company. Hotel improves customer experience and increases bookings to almost 2 times. A bank reduces errors and cycle times by 80% with enhanced customer satisfaction index. Insurance claims time reduced by 70%. What is common here? Just write in the chat box. What do you see common here? And if you can write in the chat box, that will be great. Yeah, so Momita, Ali, Atar, everyone is telling there are improvements. Yeah, Oliver, Omar, Talakokula, yeah, uh, yeah, everyone is telling that things have improved. Okay, Deepthi, okay, yes, all of you are right. All of you are right, and they are all Lean Six Sigma projects done by us in different industries. So Lean and Six Sigma can improve any industry. How? By taking up improvement projects. Okay, so there is a difference between process and project. I will tell you the difference in a short while. Okay, so if you ask me what is Lean and Six Sigma, Lean and Six Sigma is a way to improve our process using project approach. Improving our process using project approach. Okay, so these are the things, lots of things for lots of clients we have done. And now let us look at what Lean and Six Sigma can do in short. It can reduce the cost, it can reduce the defects, it can reduce the wastes, it can reduce the rework, it can reduce the cycle time. It also improves the quality, production efficiency, productivity, customer satisfaction, capacity, profitability, and resilience. And when you join our training programs, I not only give you, of course, I conduct the program live, but also give you the videos as well. Now, the videos are professionally shot already. And if you see the same thing which I just, hi, I'm Amitabh. Just now, I told you, I'm telling exactly the same thing here. Joining our courses and Anexas. I'll be taking you through the green belt topics and the black belt topics day by day, hour by hour, and also share my experiences because Lean and Six Sigma has made a huge difference to my professional career. If someone asks me what is Lean and Six Sigma, I would say that Lean and Six Sigma is a project approach towards process improvement. Means you select projects. Now, what is the definition of a project? Project has a starting point and an end point. Project is a one-time activity. So, what do you do in Lean and Six Sigma? You choose improvement projects in the processes and ultimately reduce. Hi, I'm Amitabh Saxena. So let me explain what do you mean by, what do you mean by project in a process? Because a lot of people are telling that they are totally new to Six Sigma. So let me begin with basics. So when you are looking at any process, think of your organization. If you are, some people are telling they are students, so think about your institution. Or if you are working in hospital, think about your hospital. If you are working in manufacturing industry, think about manufacturing industry. Your organization produces certain outputs through a series of process steps. You have got certain inputs. These inputs are getting converted into outputs. Through a series of process steps. So what is a process? Process is anything which you keep on doing again and again, repetitively. Now, whatever you keep on doing again and again, repetitively is known as a process. Okay. So if you are manufacturing a car, manufacturing the car is a process. You have raw materials, and then through a series of process steps, you produce an output. Output is either a product or a service. Suppose you are in hospital, then your output is a service. The treating the patient is a service. If you're working in a bank, opening an account or giving a loan is a service. So you are producing an output through a series of steps, which, of course, this output, it goes to the customers, consumed by the customers. So if you are in healthcare, customers are your patients. Okay. Manufacturing, if you're manufacturing a car, the car user is your customer. They will give you, customers will give you feedback. And also you will predict the demand of your products. And the planning and scheduling department, okay, planning or strategy department, will produce a strategy and tell the suppliers to supply the raw materials, tell the suppliers to produce the inputs. The inputs are supplied by the suppliers, they're processed through a series of steps, and you create an output which goes to the customers. Outputs are either products or services, and the customer, we want to keep him happy. They are interested in certain measures of our products or services. Typical measures are cycle time to complete the job, activity, or errors, and the costs. Now, these are the three typical measures. We call it a CTQ, critical to quality measures, also called as Y. We designate them as Y. In Six Sigma, Lean Six Sigma, we designate them as Y. Y means like Y variable. We call it as Y variable. Cycle time, time taken to discharge a patient. Okay, time taken to make one car. Okay, time taken to make a dispatch in a warehouse. Delivery time, cycle time, time taken to open an account. These are all examples of cycle times in various industries. Errors committed during the dispatch delivery, safety related issues in a warehouse or in any organization, errors committed in our hospital, costs of accomplishing a particular activity or producing an output. These are all measures. Plus, there are other measures also, like if you're manufacturing a chocolate, weight of the chocolate. If you're an oil industry, the viscosity of the oil or boiling point of the oil. So these are all examples. If you are from healthcare, nosocomial infection rate, mortality rate, they are all measures. So these are measures important from customer's point of view. We call them as CTQs. Why? I hope you are with me till now. And this is applicable to both product and services. Are you with me up to here? And looking at your organization from this perspective, not from your department's perspective, is known as systems thinking. You are thinking about the system. You are not thinking about your department. This is known as systems thinking, also known as value stream map. Also known as value stream map, VSM, value stream map. This is how the value is created in my organization. Suppliers are supplying the inputs. I process them. Then customers receive the output. They get the value out of it. Then they give me feedback, which is also valuable to me. Then planning team plans, which adds value. Suppliers supply the raw material. And this raw material, again, we keep on adding value, and finally customers keep getting the value. This is how stream value, this is known as value stream map, how the stream of value flows through my whole system. So think about the system. Don't think about your department. You may be from operations department. Doesn't mean that that is the world. Actually, think about the system. You are part of the system. You are a component of the system. You may be in maintenance department, you may be in quality department, you may be in finance department, you may be in HR department, whichever department you are. You are just A, B, C, D. Don't think about your own department. Don't be happy. 9 o'clock I come in the office, and 5 p.m. I complete 20 jobs, 20 articles, 20 service requests. And that's the end of my world. No, you are part of the system. A good manager, and of course quality professional, always thinks in terms of systems. So please remember, later on I will refer to a tool called SIPOC. SIPOC stands for supplier, S for supplier, I for inputs, P for process, O for output, C for customers. SIPOC. So whenever we face a problem, first we make a SIPOC. Whichever organization we want to, any process we want to improve, first we make the SIPOC of the process. Okay. Any questions? I hope you are with me. Up to here, you are with me. I'll be a little fast because I want to give you lots of tools in the 2-hour training program. You are with me? Okay, great. Now, thank you, Oliver and Deepthi. Now, thank you, Ali. Now, Wherever I'm not performing well, see, customer will tell you there will be some specification limit. We call it specification limit set by the customer. Specification limits are set by the customer, also voice of customer. They will tell cycle time should be less than 30 minutes. Okay. Raymond, thank you. Udaifa, thank you. Thank you. Thanks a lot. Yes. I'll keep telling your name so that and I can't tell everyone's name. Richard, thank you. But I'm watching the chat messages, keep writing. I'm sorry I can't respond to everyone because I'm focused on conducting the training. Milan is even writing SIPOC. What is the full form? Great. You're taking down your notes. Great. Okay, now, cycle time should be less than 30 minutes. Error should be less than 5 per week. Cost should be less than dollar, whatever, 150 per unit. Weight. So, see, it should be between, if you're producing chocolate, 100 grams plus minus 3 grams. Okay. Shansha, thank you. Bilal, thank you. You are a civil engineer. Okay, thank you. Great. It is effective for you, HSC officer. It's very, very effective for you. Yes, of course. You see, it is effective for everyone. Whatever tools and techniques we are learning today is applicable everywhere in every industry. I have done trainings in almost all industries, projects in all industries. So it is applicable everywhere. That's the beauty of it. You can enter into any organization with confidence after becoming a green belt or a black belt. You can say, well, I can improve your process. In green belt, you learn some tools and techniques, around 75 to 100 tools you learn. And black belt, you learn 50 very high-end tools. And master black belt, you learn how to teach green belts and black belts. There are 3 levels: green belt, black belt, and master black belt. Even yellow belt, some people say yellow belt also. So yellow belt, we are doing it right now. Yellow belt is the entry level. Very, very basic level. You are not supposed to do any projects there. But a green belt and black belt, they will choose projects. Whenever your cycle time is not matching, only 90% of the time you are within 30 minutes and 10% of the time above. Delays, dispatch delays, delivery delays, patient discharge time delays, waiting time is high, errors are more, costs are more, weight variation is high. You take up project. What is the definition of a project? It has a starting point and end point. It is dead after some time. It starts and ends. It's one-time endeavor. It happens only once in the life, in the history of the world, right? So you take up an improvement project. Like, for example, I would like to reduce the patient discharge time from 4 hours to 2 hours by 31st December. Okay. I would like to reduce the weight variation in my chocolate produced by my company by 31st December. I will like to reduce the rejection rate of my products from 3% to 0.5% by 31st of December. This becomes a project. So you take up improvement projects in a process. That's what I meant. If you ask me what is Lean Six Sigma, improving your processes using project approach. I hope you understood this. That's what I said in that video. Would you be interested in knowing the history of Six Sigma? Up to you. If you are interested, I will tell you about it. Otherwise, I'll directly jump on a learning. You know how it started. You want to know that? I can tell you that. Otherwise, I'll start learning directly. History, you are interested. Okay. Okay, so history or learning? You tell me quickly. History. Okay, history. Okay. Raymond is telling history here. Let me play the video.
Things. So, well, Lean and Six Sigma green belts and black belts are those individuals who can do improvement projects in the organization
By the way, this gentleman is me only. Just 4 or 5 years ago, Now I'm older. Okay, please go ahead.
choosing improvement opportunities and converting these improvement opportunities into projects. It all started in Motorola when Bob Galvin, the CEO, took a challenge saying that I would like to improve everything by 5 times in the organization. And he was told about some statistical tools and techniques which Bill Smith and Michael Harry were using to improve the processes. Bob Galvin was so much impressed with what Bill Smith and Michael Harry were doing, he told them to develop a methodology which, if applied to the organizational processes, can improve the processes. So he was particularly impressed with what Bill Smith and Michael Harry were doing. They were choosing improvement projects. Now, what is the definition? As I told you, definition of a project is it has a starting point, it has an end point, it doesn't exist after some time. So Bill Smith and Michael Harry would translate the improvement opportunities in the organization to projects, and applying tools and techniques of statistics, they would find the root causes of the problem, and then after solving the root causes of the problem would impact the organizational bottom line. Both of them developed Six Sigma DMAC methodology. They started training the green belts and black belts. Green belts and black belts were the people who could fight all the quality related problems in the organizations. Six Sigma brought in a lot of benefits for Motorola, and it also won Malcolm Baldrige Award in 1988. Jack Welch of GE was so much impressed with this methodology that he told his employees that you would not be promoted if you are not a green belt. So everyone wanted to be a green belt, everyone started doing projects. Then GE started telling their vendors and suppliers that if you want to have business from GE, you need to implement Six Sigma. So vendors also started asking what is Six Sigma, and GE would say that we will send our master black belts and train you in this methodology. So in this manner, Lean Six Sigma spread out around the world, and today almost 80% of the Fortune 100 companies and many, many more companies around the world have implemented Six Sigma and Lean. Lean started in Toyota.
Okay, so Lean started in Toyota. I'll not tell you the full story because let me instead talk about what is Lean. So Lean is about, see, there are two aspects, Lean and Six Sigma. So when we say Lean, Lean is about mapping the process, identifying the waste in the process, and then reducing the errors in the process. That is about, say, one aspect. And the Six Sigma is about reducing the variation of our products and processes. So consistency, improving the consistency. So if you are doing good, you should be consistently doing good. Yeah. If you are on time, you should be consistently on time. There should be no variation. Your chocolate weight should not be varying. It should not be sometimes high, sometimes low, sometimes on specifications. It should be always within specifications. So that is what we call it as reducing the variation. So let us have a look at first the Lean part. Now, very quickly, because I saw a lot of people are from healthcare, so let me start with healthcare examples. When I'm explaining Lean and the wastes, I will take healthcare example. When I'm explaining variation, I will take manufacturing example. Then we'll together do a project which is from generic example, like reducing the recruitment cycle time in a company. Now, recruitment is a process everywhere in all companies. It is a part of every organization. So I hope everyone will understand the recruitment process project. So we'll take up an improvement project to reduce the recruitment cycle time of our employees in the company. That will come a little later. But let us first understand, before I go ahead, who's a green belt, yellow belt, black belt, master black belt. Yellow belts are the people who know the basics of Lean and Six Sigma. Green belts are the people who know the tools and techniques, and they can apply these tools and techniques to improve any process in any industry. Black belts are the people who can apply some high statistical tools, some more high-end statistical tools, so that they can improve complex processes and also solve some complex problems. And master black belts are those who can train others, who can guide others, who can roll out Lean and Six Sigma in the organization, who can drive multiple projects, and who can make a very big impact on the organization's profits and also improve the overall quality culture in the organization. Because if you establish a good quality culture in the organization, half of your job is done. It's very difficult to copy the culture of the organization. So if you can establish a good quality culture, whoever comes to this organization, they will always produce excellent product and services. Problems are not in the people. Problems are in the processes. That's what Dr. Deming said. 85% of the problems are in the processes, not in the people. A good person in a bad process will not be able to do anything, and a person who's average, very low skilled person, but if you are given a very good process and excellent culture, you will be surprised that this person is producing excellent results. So more depends on the systems and processes, and we as leaders, as managers, are responsible for changing the processes, and that's where our focus is on. So first, let us understand what is lean. Lean is about reducing the waste. So first, map the process. Mapping means go to the field, go to the place of action. Walk in the place of action where the people are doing the job. Go around and see what's happening. And when you map the process, you will find a lot of waiting is there, a lot of transportation, unnecessary transportation is there, lot of over processing, means customer is not asking for certain jobs to be done, but still you are wasting your time to do those jobs. Lot of inventory, work in process, inventory is there. Rework and rejection, a lot of errors you commit. Any error committed by you or by anyone is a waste of resources or time of the organization. Rework, anything starting with is a waste. You committed, like say, suppose I commit a mistake and then I rework on it, I can redo it, means I'm wasting my organization's resources in first committing a mistake and then again reworking on it. So we should do everything right the first time. So underutilized resources, waste of intelligence, that is also a big waste in the organization. So let us take some example, because I saw a lot of people from healthcare. Let me jump a little bit and I'll take some example from healthcare. And after that, I will come back and start talking about the Six Sigma as well. Okay, so war on waste. So what is waste? Yeah, waste means what? Non-value added activities. Non-value added activities. Yes. So these are some examples of waste: processing, motion, walking, searching, transportation, man hours. To remember these 7 or 8 ways, you can use the acronym called ISWIM2. ISWIMTOO. ISWIM2. Okay. ISWIM2. ISWIM2. Okay. Or Tim Woods, there's another acronym. Tim Woods. Tim Woods. Same, if you rearrange these 8 ways, TIMWOODS, Tim Woods. Or there is another acronym, downtime. Downtime. Okay. Tim Woods, downtime. Yeah. Anything, whatever you, or I swim too, whatever appeals to you. So some of the wastes are obvious wastes, but some are hidden wastes. Let us take some examples. Overpricing, overtime. These are all hidden wastes. We don't even consider them as wastes. Let me give an example of, I did one project in Beijing Hospital in China. I've done multiple projects in multiple hospitals in Middle East, Gulf, Saudi Arabia, UAE, Oman, Qatar, Sidr Hospital in Qatar. Anyone from Qatar is there? UAE, lots of Cleveland Clinic, UAE, so many. JCI, sorry. Anyway, let me not talk about it. Let's learn. Let's learn today. Yeah. So let's take an example of like the blood test processing time. So walking to outpatient department is a waste. Yeah. Registering in OPD is a waste. No, you'll say, how can it be waste? Actually, look at it from the customer's point of view. Is the customer willing to pay for that step? Is it getting him closer to the value? What is the value here customer is looking for? The customer is looking for the health status of his health, his or her health. Now, walking to OPD, registering in OPD, walking to lab is not adding any value. They are all wastes. Only two value-added steps are here, drawing the blood and testing the blood. That's it. So we have eliminated lots of steps in lots of hospitals. These steps of walking to lab and etc. They have been eliminated. Even registration has been eliminated by them. Anyway, one of the hospital determined that 80% of the nurse calls are from patients. Sorry, from inpatients were housekeeping in nature, like my bed cover is dirty, my pillow cover is dirty. These are not the things nurse is supposed to handle. Nurse is there to give you the medicine. She will forget to give you the medicine if you engage her in doing all these activities. It's waste of her intelligence. Okay. Some other examples. Now, I'm not going to give you the details, but here there is a YouTube video, lots of YouTube videos you'll get. Please subscribe to my channel, Anexas channel, lot of case studies, lot of healthcare related case studies. There have been also some of the healthcare related case studies were presented on 27th of July in my LinkedIn live event when we celebrated our 19th birthday of the organization. And you can have a look at manufacturing, services, healthcare, a lot of projects I had presented. So I'll not go into the details, but very quickly, we could double the cardiology lab capacity from 8 to 16, reduce the diagnosis to exam time from 2,700 minutes to 64 minutes. We cut down the admission time from 17 minutes to 5 minutes. We reduced the signature. Lots and lots and lots of improvements we could do using these Lean and Six Sigma tools and techniques. The case study is given here, but a detailed case study I have presented in our YouTube channel. You can always subscribe to that. So idea is to reduce the waste as much as possible and create as much of value as possible for the customers. Unnecessary process motion, unnecessary waiting, unnecessary transportation, unnecessary errors, all errors, unnecessary stocks in production. They are all waste. Underutilized person is a waste. Overutilized person is also a waste. Underutilized resource, equipment is a waste. Overutilized resource is also waste. The cost of 5-minute MD walk is a waste. Walk to elevator, 1 minute. Elevator wait is 3 minutes. Elevator travel is 1 minute. Walk to lab or pharmacy is 1 minute. Nurse cost per hour is $50. Cost of one trip. So a lot of US hospitals are also my clients. A lot of people from US, they have attended my CPHQ training. I also conduct CPHQ training with a 99% success rate. 99. Last 3 batches is a 100% success rate. If you are from healthcare, to join my CPHQ 2-hour free session also. And also, you can join my Saturdays. I conduct CPHQ training from morning to evening. So 6.5 to 7 hours training I conduct. You can join and you can pass the CPHQ examination. And Lean and Six Sigma, 100% guaranteed passing certification. Certification is valid worldwide. Okay. Some people are asking these questions, so I'm just replying to them. Thank you for asking this question, but I will park these questions towards the end. I'll answer all these questions. Yeah, so now looking at these calculations, cost of 5 trips per day per nurse is $25. Cost of elevator wait per day per nurse is $12. What does it mean? I'm losing millions of dollars in just due to the elevators. So we have to redesign our system, redesign sometimes our layout, our departments to save the costs. Lab and pharmacy on second floor, radiation equipment on ground floor, get them on same floor. Hospital saves millions of dollars. It is unimaginable but true. Yeah, eliminate exam room interruption. It's waste. Again, some example. There is a technique called poka-yoke. Poka-yoke means, it's a Japanese word which means foolproofing. Even a foolish person cannot commit a mistake. Like, for example, I just cooked some rice. By the way, I'm staying in Riyadh alone, so I generally cook. But there's a rice cooker. I put rice there, and I just sit relaxed because I know it will switch off automatically. It will not burn the rice. It is mistake proofing. Poka-yoke. Poka-yoke means even by mistake, you cannot commit a mistake. So develop your system such that you cannot commit a mistake. Like, for example, some of the equipments cannot be set or operated beyond normal, safe, or maximum levels. Yep. So all these are examples of, Poka-yoke. So try to apply Poka-yoke as much as possible to your systems. Mistake proofing. It was given by Shijo Shingo. He did not want his workers in the manufacturing unit to commit any mistakes or errors. He wanted zero defects. So he said, even by mistake, my people cannot commit a mistake. I'll design the system like that. And he got some uh, good suggestions, and he created some good ideas. So the whole program of Poka-yoke, or a short program of Poka-yoke, is there on my Anexas YouTube channel. You can always watch that. Okay. Now, yeah, some more examples. Some abnormal values will be rejected automatically. Oxygen and nitrogen cylinder cannot be connected to each other, even though if you want to connect, even by mistake, you cannot connect because the size of the connector is totally different. Other examples could be fixed number of packages during the surgery, complete catheter kits for insertion, prepackaged medication card with correct dosage. All these are examples of Poka. Anyway, so I had given good examples, enough examples of our healthcare. Now let us talk about some other industry also. By the tools, techniques, this all things, whatever I described, is very much applicable to manufacturing, banking, supply chain, warehousing. I've done many projects in warehouses. I've done many projects of supply chain. I've done many projects for retail industries. And lots of projects, reduce the out of stock situation, reduce the picking up time in warehouses, so many. See, all concepts are exactly the same. Now, coming back to this, variation. Now, I'll talk about variation, and this will require a little bit of explanation. Okay, so I will describe about this variation and normal distribution a little after some time. Let us start doing the project. Okay, so let us start doing define, measure, analyze, improve, and control. These are the phases which we follow as we do the projects. Okay, so DMAC. So we'll be learning some of the tools as we'll go through this training. We'll learn in define phase, we'll learn SIPOC and project charter. In the measure phase, we learn types of data, normal distribution, and control charts. We learn in analyze phase, we learn about cause and effect diagram, Pareto analysis. If time permits, box plots and scatter plots, I will just show. I may not be able to explain and give full details, but I'll give it demonstration. We learn very quickly about process mapping, identifying the waste, which waste I have already spoken about. And then improve, we learn about brainstorming. And Poka-yoke I have already talked about. 5S, I will give you a video. By the way, all my training programs are also in Arabic. Okay, please understand. Arabic, English, Tamil, Hindi, so many languages we have got, all due to AI. By the way, Hindi program I conduct live, and Arabic, those who don't believe, and if you're saying that I don't believe you, let me talk about the same thing which I just showed you just now. I showed you about welcoming message, etc. Right? Those who understand Arabic, please watch this, and it is fairly close to what I mean in English, or what I meant in English. I'll play just for 1 minute, if you permit me. Those who don't understand Arabic, don't worry. I have already explained this to you.
مرحبا، أنا أميتاب سكسينة. شكرا لانضمامك إلى دورتنا ومقتطفاتنا. سأطلعك على موضوعات الحزام الأخضر وموضوعات الحزام الأسود يوما بعد يوم وساعة بساعة، وسأشارك أيضا تجاربي لأن لين وسكس سيجما أحدث فرقا كبيرا في مسيرتي المهنية. إذا سألني أحدهم ما هو لين وسيكس سيجما، أود أن أقول إن لين وسيكس سيجما هو نهج مشروع نحو تحسين العملية، ويعني أنك تختار المشاريع. والآن ما هو تعريف المشروع؟ المشروع له نقطة بداية ونقطة نهاية. المشروع نشاط لمرة واحدة. فماذا تفعل في لين وسيكس سيجما؟ اختر مشاريع التحسين في العمليات، وفي النهاية تقليل التكلفة
Okay, great. So I hope we got it. Yeah. Yeah. I hope from people from Saudi Arab and Gulf, I hope you are. Can you please let me know if it's matching what I just said initially in English? I hope it matches. Okay, coming back to the English version. Great. Now let us look at. Oh, am I sharing my screen? Sorry. So thank you. I think some people are telling, yes, it matched really well. Okay. Oh, how can Dinesh tell? Dinesh, you know Arabic, is it? Okay. Those who know Arabic, I want to hear from them. Okay. So now let us learn. See, now let us learn DMAG. So all this whole training program. Yeah. So some little improvement is definitely needed. Little improvement is definitely needed, and we are working on it. It's still in the pilot. FMEA. I will strongly recommend. I will not be able to teach FMEA. It's a very powerful tool. It takes a little time. It takes 20 minutes of time. But please do watch my FMEA video. You can see, apply this FMEA. It's a powerful tool. It's a very powerful tool because today is yellow belt. I can't devote specifically to one particular tool. It's such a powerful tool. You please watch my video. FME. It has been watched by 1.3 million, I think. It keeps increasing. Every month, 100,000 people increase. 1.3 million people have watched. Let me show you,
a very powerful tool called Failure Modes and Effects Analysis. This tool, FMEA, was first used by NASA to send the people on the moon. And they did not want to fail, and that is why they used an FMEA, failure mode.
It is 1.3 million people, most watched video on FMEA, failure mode. Very, very powerful tool in automobile industry, healthcare industry, airline industry, manufacturing industry, retail industry, banking industry, you name it, everywhere. This is a very, very important tool. Please go ahead and watch this. I will not be covering this in this session, plus it's a very, very powerful tool. Do watch it. And Arabic version is also available of this particular tool. Okay, coming back. And the link is given here. Please store this link. If I can request my team to send it by email also, please do that. Or in WhatsApp also. If you have got a WhatsApp group, we can do that. I hope we have created a WhatsApp group for all the attendees, the broadcast group. If not, we can do that. Okay, so now let us do a DMAC project. So define phase. What do you do in define phase? Whatever you want to improve. We are given to improve, reduce recruitment cycle time. And we are going to apply DMAC, define, measure, analyze, improvement, control. To give a very simple example, day-to-day life example, before we proceed to the industrial example, suppose I want to reduce my weight. So I'll define my problem first. My problem is I am 90 kg. And now my goal statement is I want to become 80 kg. Okay. I'm taking an example, right? In the measure phase, actually, I'll collect the data. Because in Lean Six Sigma, we say, in God we trust, rest others bring data. I'm not going to trust you unless you show me the data. So I collect the data. One day I'm 90, another day 90.5, 89.5, 91, 90.2, 90.3, etc. I calculate my average, I calculate my standard deviation. So average is 90 and standard deviation is, let us say, 0.5. So based on that, I make my histogram. See, if I plot my weight, just 30 samples, if I plot, I'll get to know how my process is behaving. So I will know that, my weight overall is 90 kg. It goes up to 91.5 here and it goes up to 80.5, 88.5 here. This is my today's process. This is my status today. I measure it. Okay, I display it. I tell the world how I am performing. Then once I know that, and here, these limits, we call it as control limits. Okay, my process performance is fluctuating between two limits. We call it as lower control and upper control limit. I will talk about it. Don't worry. I'm just giving a very, very brief overview. So I collect the data and I find that my weight is varying between 88.5 to 91.5. Okay. Now in the analyze phase, I find why it is behaving like that. So my why here is the weights. And the factors which are influencing my weight, I will try to brainstorm. I can say my portion of food I eat, my diet, my exercise, my sleep, my stress, all these things. These are the reasons. But not all reasons are responsible for high weight for me. Everyone has got one or two root causes. We apply 80-20 principle. 80-20 principle is known as Pareto principle. I'll describe it. In the next 1 hour, I'll tell you all these things. 80-20, actually, Pareto was an Italian economist who found that 80% of the wealth or the land in Italy was with 20% of the people. 80% of the people owned 80% of the land was owned by 20% of the people. 80-20 rule. Pareto principle. So I will apply Pareto principle and I find that only two causes. And actually I did this project 5 years ago and I found my two root causes were lack of sleep. And my team members were kind enough to support me on that project and I was able to improve my sleep and also a portion of the diet. I was eating good food, but I was eating too much of good food. So that was also a problem. So the calories were high. So two things I worked on. Exercises I was doing really well, so that was not a problem. But these two are the root causes. I worked on them. I improved on that. I got some good ideas. I created some ideas related to the root causes. See, that's the difference. In the define phase, I will not jump to conclusion. I want to reduce from 90 kgs to 80 kg. I'll not say, oh, to go for exercises. Who told you that exercise is a problem? No, data-oriented approach. Let me go to the analyze phase, prove using data that what is the problem root cause. How will you do that? We will see that. Now you are going to see that. Okay, well, completing my story. So 88.5 to 91.5, this is what I was earlier. And in the after improvement, I became 82, 81 kg. I'm fluctuating today. For the last 5 years, I'm between this range. I'm able to control. Control means sustain the gains. Don't go back to your original state. Don't go to your original state. That is what you saw that version in the video. I was like little good, looking nice. That was immediately after the project. Actually, I had reduced to 77, 76 kg. Then I went to 80 anyway. So, but the fact is that it improves your overall health if you improve. So here, my purpose was to improve my health. Yeah. But the CTQ which I targeted was my weight. The measure which I target, you cannot improve if you cannot measure. You cannot say, I want to improve my health. No. What is the measure? Like weight, sleep, stress levels, exercises. These are all measures. DMAC. Now let us do DMAC on our recruitment cycle time. So we want to reduce the recruitment cycle time of the engineers in this company. This project I did around 12 years ago for Technip. Technip is an engineering company. We start with identifying the team. So we write the team, the process name. What is the process here? Recruitment process. We identify the head of the department and designate him as the champion of this project. HR director is the champion or the sponsor. Process owner is the owner of the process, the manager of the process, who is responsible for the performance of the process is recruitment manager. Master black belt is the person who's guiding the green belts and black belts, and the green belts are the people who are doing the project. Okay, so now we have formed the team. The people who undergo the training are the green belts. They'll be doing the project. And who's going to train them? I'm going to train them. And they will do the project in recruitment manager's process. Recruitment manager or HR director need not be trained, but they should be identified as process owner and champion or the sponsor. Now I start with the CPHQ. I look at the process because problems are in the process. They are not in the people. Problems are in the processes, not in the people. I will not blame the recruitment team. Otherwise, what is our habit? Okay, my recruitment cycle time is high because my recruitment team is not working. They're sleeping. Sometimes we will just blame them. No blame, no blaming the people, no blaming the department. Where is the data to prove? So what we do, we just make a CPHQ. We start with the customers. We identify the customers. Who are the customers? The departments. Okay. Departments are the customers. What is the output? Recruited employee. What is the measure on the recruitment employee? Recruitment time. Measure on the output is known as the Y, is also known as the CTQ. Critical to quality characteristic. What is the basic 5-7 level high level process steps? Receive and shortlist the resumes, interview the shortlisted candidate, negotiate and finalize the contract with the prospects, develop mobilization plan, mobilize the candidate, welcome the candidate on board. What are the inputs? IT system, job description, CVs, budget, HR staff, travel documents. Who are the suppliers, departments, management, etc., etc. Now, if there is something wrong in the recruitment process, I'm not going to work on reducing the recruitment time. I will find which X factors, the X factors, these are all known as X factors. Problems are in the X factors. Problems are in the inputs. Problems are in the process, not in the output or in the people. Focusing on the Y or the result. Y is the result. Y is the output. It's not in your hand. Result is not in your hand. Result will be delivered by the system, by the X factors. What is in your hand? This X factor. Training the people is in your hand. Staff is not skilled. Train them. CVs are not received or not there. Getting the CVs. Budget is not approved. Or getting the budget approval on time. They are all in your hand. And not all X factors are responsible for this delay. Only 2 or 3 X factors are responsible. Which are these X factors? We have to find that out. Using the data. Okay. Then we start collecting. So we make, first of all, let me tell you, we make a project charter. Today, I'm taking 50 days to recruit an employee, and I would like to reduce it to 30 days by a date. Smart goal statement. And if I do that, it's going to save some millions of real, rupees, dirhams, dinars, and dollars. This is a project charter. I created a project charter that becomes my define phase. I move on to the measure phase. Measure phase, I collect the data. And here, when we talk about data, people are afraid of data. I don't want to give you the data because I feel if I give you the data, you will reveal my inefficient processes to the whole world. I will not give you the data. People will say like that. Or we'll say, I have too much of data, but I don't know what to do with that. Or analysis is too complicated. But today, analysis is not complicated. You've got all these mini tab and Power BI and Excel sheet. Simple Excel sheet is now powerful enough. Don't have to worry about it. But you should know the tools and techniques. That's what we are going to learn. Now, I will show you tools. We will not be able to practice. As a yellow belt, you are just supposed to learn. In the green belt, when you come to my green belt session, I will teach you, I will do it together. I wait for you. I'll say, please go do this. In an Excel sheet, we will do. Excel is a wonderful software. A lot of analysis can be done, and we'll teach you proper analysis. Not pivot table and all that is also very easy, but that we are not focusing. We are talking about the statistical tools, the high-end statistical tools. So we will be now. First of all, do you agree that everything can be measured? Do you agree? Do you agree that everything can be measured? So some people are telling no. Now let me tell you the rules. You can't improve if you cannot measure. And the second rule is you can measure everything. The third rule is if you think something cannot be measured, go back to rule number 2. That means everything can be measured. So let me show you how you can measure everything. There are 2 types of data, continuous data and attribute data. Okay. So something which you feel is not measurable, you try it as attribute data and you can measure it. Very easy.
You think something cannot be measured, then probably it is attribute data. Now let me tell you, how can you measure anything? There are 2 types of data, continuous data and attribute data. Continuous data can be represented on a number line. It can have a decimal place. It can also have a unit. Say, for example, age, height. Age is 52.5 years. That's my age. Height, maybe 180.1 centimeters. Cycle time of a process, 3.5 hours. Or procurement time in an organization, 120.3 days. These are all continuous data because they all have a possibility of a decimal, means they can be expressed in decimal points, and also they all have a unit. Now let us talk about.
I hope you understood this continuous data is like, can be represented on a number line between minus infinity to plus infinity. Okay. It's like any point on this number line, like time taken to complete an activity, 72.5 hours. So decimal point is possible, and hours, this always, it will have a unit. Hours, days. But attribute data will never have a unit. But still, I can measure it using count and express this as proportion. Let me take an example.
About attribute data. Attribute data can be expressed in categories. And categories can be counted. Say, for example, if you want to measure happiness, so easiest way to measure any attribute data is to create a category, and if possible, you can create a binary category. A presence or absence of that attribute can be one of the simplest categories. Hi, I'm Amit.
Yeah, here what I'm doing, I'm creating a category. What I'm telling you is that if you want to measure anything, there's a trick. I'm giving you a trick. Customer satisfaction, pain, feelings, all these things, we say we cannot measure, but create a category. Once you create a category, then you count how many times that particular category is being observed. And binary category is always possible. presence or absence of that particular attribute which you are trying to measure. Here I am giving example of happiness. You create two categories, happy, unhappy.
Happy, unhappy. So if I want to increase the happiness in the employees in the organization, then I can always count how many employees are happy. Let's say 60 employees are happy and 40 employees are unhappy. I can express this as proportion. That means proportion of happy employees in my organization is 0.6 and proportion of unhappy employees is 0.4. And it can also be expressed as percentage. Now, this proportion or percentage, they don't have a unit. And a count, like 60 employees, I can't have 60.1 employees who are happy. So the count will not have any decimal point. So this is what continuous data and attribute data is. It is very...
So this was about continuous and attribute data. And remember this, as we proceed, remember this part. And I have explained these types of data. This video is there. My team is providing links in the, you can have a look at that. My team is providing links. Just have a look at, please keep storing all the links. It is very, it will really help you. Okay. So we now start measuring, displaying our measure. And I already told you Y is the symptom, but X is the root causes. So we'll focus on Y as well as X factors. Because Y is function of X. Means my recruitment time is dependent on a lot of X factors. When I go to the doctor and I tell him I'm having fever, the CTQ or the measure for the doctor is the temperature. So the temperature is the CTQ, but the doctor doesn't try to reduce the temperature. Doctor actually analyzes. He has a cause and effect diagram, the possibilities, all the X factors. And then he or she tells me that, okay, go to the X-ray room, get a blood test report, etc. And then they analyze it, and then they give me the medicine based on the root cause. Similarly, as a green belt or a black belt, you are a physician, you are a doctor of the process. People will come to you. They will tell you, well, my process is having issues, the diseases. What are the diseases? What are the symptoms? Delays, errors, customer complaints, high costs, inefficiencies. These are all my diseases of the process. And you are here to remove those diseases. So you have to analyze. And that's what we are doing. Okay. So, okay, let me show you some. Now, let me ask you a question. Now, we have got around 40 minutes remaining, 45 minutes. Would you like to go into the deep statistics, or you want to keep it simple today? Simple, then, I'll give you all the details up to DMAC. If you want to enter into deep statistics, then you'll have to spend a little bit extra time today if you want to see the case studies. So keep it simple. Okay. Straight away. Machidiso is telling. Adira is telling, go deep. Okay. Simple. I think it's Varsha. Varsha is telling simple. Deepti is good. Okay. 50-50. Okay. Okay, no problems. Okay, what we'll do, for some people, towards the end, last 15 minutes, I will, okay, a little bit, 10 minutes, I'll go into deep statistics and I'll come back. Then we'll come to the normal thing, right? See, let me tell you one interesting phenomenon. Mr. Carl Friedrich Gauss, in 17th and 18th century, he found one interesting thing about all the repetitive processes. So this is, excuse me, for some people I want simple, but some people want deep statistics also. I'm just, give me 10 minutes, 10-15 minutes, I'll be back again. in the normal, simple mode. But I'm just talking about a little bit of deep statistics, and it's not that difficult, Let me explain this. See, this Gauss, he found one interesting phenomena. Any repetitive process, it follows this a pattern. Like if I take my traveling time to my home, most of the time I take 30 minutes. But every day I don't take 30 minutes. Sometimes I have to go up to 35, 40 also, 45 also. Sometimes 25, sometimes 20, sometimes 15. Okay. Similarly, my sales in my company, sometimes this is 30,000, 35,000, 40,000, sometimes 45,000. But never go below 15,000, never go above $45,000. Similarly, patient waiting time in my hospital, on an average, it is 30 minutes, goes up to 45 minutes. Very rarely it goes above 45 minutes. Very rarely it goes below 15 minutes. Okay. In my logistics company, the time taken to dispatch a material requested by the customer from my warehouse takes between 15 minutes to 45 minutes. Applicable to all processes. I told you, right? All tools are applicable to all processes. Everything is a number. Repetitive processes are there in every company. Now, this is interesting to know that always you will find, now this is a real interesting one. Always you will find this type of distribution. We call it as normal distribution. It is normal to obtain a normal distribution. And one more additional thing Mr. Gauss found very interesting thing. He said, we can always calculate the average of a data. And we can always calculate the standard deviation of the data. Now, how to calculate standard deviation and what is the formula? If you are interested, for yellow belt, it is not a must. But if you still are interested, I will ask you to watch of my video of standard deviation. There, I have even derived the formula of standard deviation. It's a very interesting video. Those who want to go into the deep into the statistics, please watch that. So that will be given by my team member in the chat box. And you can store that link also. But remember, FMEA is something which I am recommending heavily. Please do watch that. I had already given you that FMEA link. Once again, I'll give it to you, those who couldn't join earlier. Strongly recommend, please watch that. But anyway, coming back, Gauss, he found that average, like for example, my traveling time, average is 30 minutes and standard deviation is 5 minutes. Easy to find standard deviation in just few clicks. I will show you. I will show you how to do that. Like my recruitment cycle time. See, when you come to my Lean Six Sigma Green Belt training session, I teach you Excel sheet, how to do these calculations in Excel sheet or in Minitab. We give you the software also. Okay. Please do join my Green Belt or Black Belt training program if you are interested. You will learn a lot. And I will be also training you not with such a heavy speed. I will be teaching you the very cool, very nice, very slow pace. And like the way now I am doing, like very relaxed. Together we will do. Together. I will tell you to do this. Now I'm just showing you because I want to pack a lot of information in the shortest possible time. So again, let me increase my speed. So here, going to recruitment cycle time. Okay. Again, very easily. Now, don't worry about what I'm doing. It's just few clicks. You can learn very easily by attending a session. So I know average is 50 and standard deviation is 5 approximately. So coming back to our Gauss, he found that you can easily find average, easily find standard deviation. In the Excel sheet, the standard deviation formula is equal to STDEV. It takes 5-10 minutes to do it together. In the green belt session, I will do it for you. I'll do it with you. The beauty is all of your processes have average and a standard deviation. And as per Gaussian theorem, within plus minus 3 times the standard deviation lies 99% of your total population. 99.73% of your total population always lies between minus 3 times standard deviation to plus 3 times standard deviation. Now, this is a surprise. This is a phenomenon. Okay. For those who are totally new to this concept, they will say, how is it possible? It's there. It's the theorem. So let me go back to my example. I'm taking average 30 minutes to reach my office every day. And 5 minutes is the standard deviation, which I can easily find using my Excel sheet. Now apply Gaussian theorem to that. So this is 30. 1 time standard deviation will be 35, because 30 plus 5. I'm adding 35. Right? 2 times standard deviation will be 40. And 3 times standard deviation will be 45. Similarly, this will be 25, this will be 20, and this will be 15. We call this 15, which is minus 3 times standard deviation, we call it as lower control limit. And we call this 3 plus 3 times standard deviation, which is 45 here, as upper control limit. We call it LCL and UCL, lower control limit, upper control limit. And if I plot this lower control limit and upper control limit, I can say my traveling time is always fluctuating between 15 to 45 minutes. This is my natural variation. It is due to lots of causes which are acting on my system of traveling to the office. A lot of X factors are influencing my system when I'm traveling to my office, like traffic, then weather, my mood, the vehicle, the route, lots of things. These are all my X factors affecting and influencing and producing this variation. We call it as voice of process. This is voice of process, as if process is telling me that my traveling process is telling me that I'll behave between 15 to 45 minutes, always. Whole year, travel anytime. You will take between 15 to 45 minutes. This is the way I am. This is the way my process is. Yeah. So I display this, and we call this as a control chart. What I just created is a control chart. My control limits, control chart. This is how I'm behaving. Now, my whole idea of process improvement is, let's say it's not my traveling time, but my patient waiting time in the hospital. My whole idea is to reduce it to new values between 0 to 10 minutes. This is known as improvement. The improvement is like shifting the whole system, shifting the DNA, like changing the DNA of my process. Earlier, my process was between 15 to 45 minutes. Patients were waiting between 15 to 45 minutes. Now I want to change the system, bring in some new changes. And now it will become 0 to 10. That's what we have to do in the improve phase. But before that, I have to investigate why I am between 15 to 45 minutes. What is the reason? Let us explore that. That's what is going to go into the analyze phase. Now we are in the measure phase. So I gave you some deep statistic knowledge. Now let me ask you, have I confused you? I told you, 10 minutes. Some people wanted, some deep statistics. Are you okay? You are still with me, or you have run away? Let me see how many people have run away. People are still around. Oh, thanks for that. Oh no. Okay. See, statistics is simple. It is not definitely difficult. Okay. So what we do is, now let me go back to our this recruitment cycle time. So I collect the data, and the best part is 15, 30 sample is good enough to make the judgment about whole population. 15 to 30 samples is good enough. So we did that, and we also can create a control chart. So my recruitment is taking place between 36 days to 64 days. These are my lower control limit and upper control limit. This is how I'm behaving today. This is how my recruitment process is behaving. Okay, great. Super. Now I need to do something about it. There is one more I'll not be covering in yellow belt. You can also calculate the sigma level of the process. So for that, you have to first define a defect. Like any recruitment taking more than some particular number of days is a defect. And then I count the number of defects. Then I count the number of defects per million opportunities, DPMO. This I will not cover in yellow belt. It again takes some time. But all these videos are available on my YouTube channel. So bits and pieces are there always, those who are interested. By the way, when you come to my session of green belt, the whole training is given to you live. That recording is also given to you. Then I can sit with you personally for some queries if you have. I have a team of master black belts. I'll allocate them to you to sit personally with you and remove any issue, any question if to answer your questions, to remove any confusion if you have about any topic. So we are highly dedicated. 25 years I have been conducting training programs, and still I don't want to give up. I can now relax and enjoy my time and enjoy my life. But still, I'm enthusiastic about conducting the trainings. And that is why I keep doing it. My team tells, you have grown old. Stop. Give chance to youngsters. Anyway, we have youngsters. But I still keep doing. So anyway, what I was talking about, I'll teach you how to do the sigma level calculations, etc. And that I will not cover here. But separately, it is given, again, as usual in my channel is there. But let us move on. More importantly is, but just to tell you, see, one thing I can tell you. See, as the sigma level increases, your defects reduce. So at 6 sigma, you are at 3 defects per million opportunities. If your defects are very less, three defects in 1 million opportunities, you are at 6 sigma. Now you don't have to be at 6 sigma every time. Wherever you are, you just have to improve sigma level. So that requires around half an hour to 1 hour explanation. I'll park it for the time being. As a yellow belt, you have to just know bits and pieces. Now, this is important for you to know. Analyze phase. You can follow 2 doors. Now, you are interested why my recruitment cycle time is high. Tell me why. That is what we are interested in, so that I can take an appropriate action. So there are 2 doors you can take, process door and data door. Process door means that lean route, we talked about map the process, do Gemba walk. Gemba means go to the field, go to the place of action. In Japanese, Gemba means the battleground. You go to the place of action where the people are doing the job. And see, map the process. And then try to identify the waste. And you'll find always, trust me, 30, 40, 50, 60% of the time is waste. It's so easy to improve your processes. Very easy. People will salute you. We enjoy such an easy job to improve any process. You just know the tips, tools, techniques. We teach you that. So you can do value-added and non-value-added analysis. reduce the time plus also data door, make a cause and effect diagram and control impact and Pareto and box plot and scatter plot. Let's see one by one. Analyze phase. Analyze phase. So you can start with the process map. Identify the waste. Once you identify the waste, can I eliminate? You can use escape technique. Escape. Eliminate, simplify, combine, automate, parallel. Escape has been explained with an example in my one of the videos. The link is going to come up shortly in the chat box. Okay. So you can always do escape, eliminate, simplify, combine, automate, and parallel. Can I ask these 5 questions on every step? Can I eliminate? Can I simplify? Can I combine with this another step? Can I automate? Can I make it parallel? Means 2 steps. Can I do parallel instead of series? Okay. If I can, give those suggestions. After that, you go to the, I'll take you to an analyze phase data door. Data door means you get hold of the people who know the process well and tell them, okay, please write all the possible causes, whatever you can think of, write all the possible causes. What is leading to high recruitment cycle time? People will write. You can use man, machine, material, method, manpower. These are all 6 M's. So they have used it. You can use affinity technique to combine the similar thoughts together. Affinity. Combine the similar things together and group them. That is known as affinity technique. We did that, and it's always, we can use it in Minitab also. So we listed down man-related causes, machine-related causes, etc. And you can make, nowadays everything is automated. Make a cause and effect diagram. Make a cause and effect diagram. Fishbone diagram. That has also been explained in detail in my videos given here. I am giving you lots of videos. Just watch them. Your understanding will improve. Okay, now, once I've got this, I would like to find out which is the major cause. I apply Pareto. So first, see, there are various ways. One of the ways is I can use voting technique. I ask people, I distribute, let's say 10 points to everyone. And I say, distribute 10 points to all these causes, whatever you feel is responsible. Okay. Okay, sorry. I think, no, it's okay. I'll just switch off my video because I think my camera battery has gone down. But it's okay. I'm without, am I audible? Yeah, still audible. That's fine.
Yes, sir. You're audible.
That's okay. So here, yeah, anyway, you have seen enough of me. So, yeah, so here we'll go to the Pareto. Pareto chart. Pareto chart means Wilfredo Pareto, 80-20 principle I told you. So I tell everyone, okay, distribute 10 points to whichever causes you feel are root causes. If you feel some causes very, very important, you can go 2 to 3 points also. So people do that distribution. Also, using red dots here, we have used that. And you'll find some of the causes are appearing most of the time, remaining they are not appearing more. arrange them in descending order. Okay. Now, if you are interested in knowing Pareto is also explained in my video using an example. You can always watch that. If my team has not put up Pareto in the YouTube, please put it. I think we had told last time also, if you've not put it, please put that Pareto. That is a procurement time example. Okay. So I will send it to you, not to worry. So Pareto, like here, I arrange everything, in descending order. You can see that. Now let us do the Pareto here. I'll show you how to do that. So I start listing down the reasons why. Some people are asking how to get the yellow belt certificate. There's a link given to download the certificate also. You can apply for the certificate. Yeah. My team can tell me. Yeah. So here, reasons. Approval time. First, recruitment got delayed due to approval time. Job description was not available. So some of the causes will appear again and again and again and again. The real data. So what it will do, it will count. If I say, please do a Pareto chart for me, after some time, it will take the voice instruction also. Right now, I have to do clicking, but after some time, don't have to click also. Just say, please do a Pareto chart for me. It will create this chart for you. Okay. In Excel sheet also, you can do this. Very easy. Those who want Excel sheet. Okay, I will maybe see. What you can do is insert, go to insert, and then Pareto statistical chart and Pareto chart. Very easy. Yeah, you can easily do that. Yeah, so I've got a Pareto chart, and if you look at this chart, it is telling me assessment time is one of the biggest root causes. 34% of the time it is appearing. Job description not available, it is appearing 23% of the time. Approval time, it is appearing 15% of the time. And total, if you find, if you keep on taking total, cumulative total, which is represented by this ascending line, two participants are raising hands, Omar and Hudhaifa. Yeah, you have any questions? Just you can write it down. Yeah. Yeah. So I hope you understood Pareto. So if I want to solve my 80% of my problem, if I want to solve my 80% of my problem, what I will do, I will just see, look at this. I will focus on the first four causes. It will solve my 80% of my problems. Yeah. It will solve 80% of my problems. Let me look at four. Now, even these also I can validate. I can easily validate using box plots and scatter plots. So let me show you this also, because I told that if I have time, I will show it to you. So I have time actually right now. So what I will do, I feel from the Pareto analysis, approval time is an issue. When we take more time, it takes more time to recruit my people. So here I will be using scatter plot. See, I'll show you different scenarios first. Okay. We already know there are two types of data, continuous or attribute. Okay. This is my recruitment time. Can you tell me recruitment time in days? Is it continuous data or attribute data? Continuous data or attribute data? Both are continuous data. So whenever I am dealing with continuous plus continuous data, I will use scatter plot. Approval time is more, my recruitment time was more. I say there is a positive relation, and I say, yes, approval time is responsible. Delay in approval time is responsible for the delay in recruitment time. But if I find something like this, okay, let me show you some data. See, for those who are totally new to this graph, see, if I take 0 day of approval, same day, no approval required, recruitment time is, let's say, 40 days. If I take 10 days, recruitment time becomes 50 days. 20 days, recruitment time becomes 60 days. 30 days, recruitment time by 70 days. So here I can see that as approval time is increasing, recruitment time is increasing. That means, yes, it is a root cause. And I will say, let me reduce approval time. I will reduce my recruitment time. Very simple. But it could be another way around also. I took 0 days of approval. There is no approval required. Still, my recruitment time is 70 days. No approval 10 days, but still I took 670 days. I took 20 days to get the approval, but still I was able to do in 50 days. In one instance, 10 days it took, and I was still able to do 650 days. Now, in this situation, if this is the case, approval time could be anything. My recruitment time also could be anything. Do you think the approval time is the root cause of my problem? Delayed recruitment in such situation? If there is no relation between approval and recruitment time, do you think that approval time is the root cause of my recruitment delay? What do you think? Or something else is the root cause? Something else is the root cause, isn't it? Something else is the root cause. Maybe the job description is availability not available. Maybe something else is there. Yes. Let us see reality. Let's look at that. Stat, graph, scatter plot. Oh, yes, it is. It is root cause. It is a root cause. Data-oriented decision making. Data is a root cause. How about assessment time? Is it okay? Let us see that. Assessment time. Let us see assessment time. Oh, it is not the root cause. So I'll scatter. So I got my root cause there. Let me also see recruitment time and job description. Is it affecting? Now, job description available or not available is attribute data. So when I have attribute data, I cannot use scatter plot. I'll be using box plot. Let's say job description availability. Now, available, not available. Available and not available is not continuous data, it is attribute data. This is, of course, our recruitment time. When the job description is available, my recruitment is like this. When the job description is not available, my recruitment is like this. What do you think? Job description availability matters? Suppose I ensure that all job descriptions are available in the company in the next 20 days. Will it reduce my recruitment time? Yes, Oliver says yes. You're right. It is. And my solution will be get your job description of each and every role. And it will reduce my recruitment time. But suppose, let me give you one example. Job description is available, still I am taking 70 days. In some cases, job description not available, still I took 20 days. Now tell me, in such situations, is job description availability is the root cause or something else is the root cause? Something else is the root cause. Yes. Something else is the root cause. So now I'm making, see, data, little bit of data, I can make my decisions. Here we use box plot. So box plot looks something like this. I'll just show you, not to worry. So here, yes. Job description available, not available. So when it was not available, I have to make the job description. It took time for me to make the job description and it got delayed. When it was ready-made available, I could make it faster. See, when the job description not available, you will ask the department, can you send me the job description? They will take 20 more days to write the job description. That's how things happen. So in my company, I will say, please make job description of every role, even though you don't have to recruit in the next 6 months, doesn't matter. I want you to make it. This policy will reduce my recruitment cycle time. That is the root cause. So this is how, you make your judgment. Well, so this is how, I'll just proceed a little fast here. So now, these were the rules of analysis. When I'm dealing with continuous data, I used a histogram. Attribute data, I used a Pareto chart, if you remember. When there are two columns, continuous and attribute, I use a box plot. When both are continuous, I use a scatter plot. So we'll practice, come to my interactive live training. Recording is available for lifetime. 2 projects are done in the class. Project guidance provided for lifetime. Lifetime association with me. Last 25 years, I've been conducting training. I'm still in touch with all my students. I like meeting my students. I like interacting with them. It's not like, you get a training from someone, that company hires some part-time employee, some person who's working in some other company. He just comes for 2 hours and then he conducts the session, he vanishes. No, we are there with you. And my team of master black belts are there with me. They are all full-timers. No part-timers, no freelancers. All are full-timers. Then we create brainstorming. Now I'm going to describe. There are different ways of brainstorming. You can use 635 technique. 6 people write 3 ideas in 5 minutes. 6 people write 3
with written form. It is also known as silent brainstorming technique. We take 5 minutes to write down 3 solution ideas on the first row of our form.
So I've got 6 people. I'll just explain, this there's not much time to show you. 635 means 6 people write 3 ideas in 5 minutes. So I've got 6 people together. I'll give this form to them. I'll tell them in the next 5 minutes, write 3 ideas. So everyone will write 3 ideas on their own paper. Then I'll exchange the paper. Once I exchange the paper, they will look at the other person's idea, whatever they have written. Another person must have written something. This will trigger new ideas in their mind and further enhance on it. And then I write 3 new ideas in the next 5 minutes. This keeps on happening and I get
Form. So
the full video is available on my, again, in the chat box. You can watch that video. FMEA, I have already told you. Once again, I'm telling 3 million, sorry, 1.3 million. Sorry, 3 million is still a long way to go. 1.3 million views. Something must be there, isn't it? Please watch that. So we collected we brainstormed, a lot of ideas, generation techniques are there. Brainstormed on that, got some solutions, implemented those solutions. And then after that, we suggested some control points also, reviews, audits, etc., control charts. And we could see that 50 days reduced to 26 days. And this was a real project, something like this, before and after. And these wonders keep happening thousands of times. I've seen that happening. Waiting time of hospitals have reduced, infection rates have reduced. Ministry of Health, I've done more than 500 projects and lots of things. You can even Aramco, ADNOC, I have presented their projects in the American Society of Quality. Yeah. Let's play a game. Ladies and gentlemen, here's your chance to win $1 million. First question on the computer screen. The inputs to a process are called the X's, the Y's, out of scope, or gauge R&R. Right answer will give you $10,000. Wrong answer will not give you anything. If you're not sure, you can always use a lifeline, phone a friend, 50-50, or audience poll. Yes, the X Factor says fastest fingers first. I could see. Anyway, a lot of people have answered the question almost at the same time. Yes. Second, how to run a process. Yes. Shah has given the right answer. Yes. First. Yunasifa has also given Satya. Oh, yeah. Analyze phase, which is not a deliverable in analyze phase, or not in analyze phase. It doesn't happen in analyze phase. What is the right answer? Which doesn't happen in analyze phase, which happens in improve phase. Analyze phase, root causes analysis happens. Root cause analysis happens, right? So D is not the right answer. List of vital few. Some people are writing D. D is not the right answer. List of vital few X factors is actually the deliverable of analyze phase. C is the right. Most of you have said C. Yes, C is the right answer. Okay, great. So now you are not afraid of data or analysis. Come with me. I'm inviting you to my sessions. If you would like to become the most valuable person in the company by applying process improvement statistical tools, I'm here for you. If you would like to become a green belt, let me ask you a question. Can we do the poll, please? So you can just answer and accordingly I'll contact you. Those who are in Riyadh, they can call my number also and I'll be happy to reply to your questions. And you can join if you are registering today or tomorrow, you'll get some special offers, some quick offers, combination. You can go for green belt, black belt, PMP together, CPHQ, a combination. It's a fantastic combination. Green belt, black belt, master black belt, and PMP, CPHQ also. It will really help you a lot. All certifications are worldwide recognized by all countries, by all companies. So thank you for answering this question. Okay. So I'll tell you what are the dates. I'll be happy to tell you the dates, and you can register here as well. Depending on which currency you are in, I'll be happy to tell you in your currency rates what is the rates as well. But it will be a great association. It will be a great journey. I promise you that you will learn a lot, and our courses are not very costly as well. Yeah, we don't spend heavily on advertisements. Yeah, so that I do see, if I advertise more, I'll get more people, but the cost will be passed on to you, right? So definitely our costs are very low. So you will be able to reduce the cost, improve the quality, become a problem solver, consult your own organization and start on your own also. If you are a master black belt, you can become an independent consultant. Don't have to retire, or you can retire and work at your own pace. People will not allow, companies will not allow you to, rest. You're such a valuable person. So, yeah, please can you show some of the dates? My team can show you some of the dates. You can choose your batches. September 28th, I am starting. I'll be happy to receive you, and I'm waiting for you to see there. If you are not able to join on September 28th, make it October 26th if you want a weekend batch. If you want a weekday batch, I've got a weekday batch also, morning and evening. Morning 2 hours, or evening 2 hours. Weekend is 6 hours every day. You can choose any of the 4 batches, and you can also join all 4 batches, no problems. No extra money for attending any number of classes, any number of times. You can join after 6 months also, after 2 years if you want to revise again. One person joined after 16 years. After 16 years, he joined the course. You can join anytime. You don't have to pay any money again if you're joining. So this is the fee structure. You'll definitely get a lot of value. I'll give you more than 100 projects from various domains. I'll tell you that there are so many students. Maybe after some time, I'll show you some of the students talking about this. I'll also tell you what is the roadmap for implementing Lean Six Sigma in an organization after this. And there is some discounts applicable today. If you do today and tomorrow, there are further discounts applicable. Please, you can register. And this includes exam fee also, certification fee also, everything included in it. We are affiliated to CSSC, IASSC, and you can, if you want to appear for any specific exam, you can appear. Don't have to do that actually, because our certification is worldwide valid. But still, if you want, you can appear for any exam which of your choice after this. Upcoming free webinars, free PMP workshop, free CPHQ workshop, you can attend. Stay in touch with us on Facebook and Instagram and also LinkedIn. We have a page. You can always subscribe to our pages, and also can always join the sessions whenever you want. Okay, can I have the screen? Okay, done. Okay. I can also, I'm not able to share the sound. I don't know why of my video, but okay. So now let me, yeah, I'll be happy to answer your questions if you have any. Meanwhile, Naveen, can you show some videos, Meral videos? I'm not able to share the sound while share. When I say share,
Yeah.
somehow I'm not able to share the sound.
Proud to provide top-notch professional courses that transform careers and empower individuals to succeed. But don't just take our word for it. Hear what our students have to say.
Yeah, the course that we did was a week-long online facilitated course. It was fantastic. It showed us the whole methodology behind Lean Six Sigma, and it also provided a various amount of tools that we could be able to use to improve all of the existing processes that we have here in the park.
Well, it was 1 week training. It was very interesting and always energetic in terms of interaction in the class. Every single day has been different, and the knowledge sharing has been remarkable.
It was a very stimulating experience where we met every day with the colleagues, all very engaged, eager to learn, and keen on and willing to actually pause, step back from their day-to-day work to get some new perspectives. So it was really refreshing.
I'm the business development manager in IFC International Medical Center. It was a great honor and a pleasure to have attending this course. It's really interesting, a lot of value adding, a lot of new concept and technique we have learned during the last 5 days. It was really, really impressive.
Hello, we want to introduce our group. We are the pioneers and we believe we can fly. We just completed the Green Belt Six Sigma training with Mr. Amitabh. We enjoyed the course a lot. It provided us with very productive and useful knowledge about statistics and about the Six Sigma and the MIC and the SIPOC and everything.
My name is Adil Rahman. I'm from Satop. I would like to thank Satop overall to give an opportunity to all of us to have a very great interactive 5-day session, full-fledged session with one of the best mentor and guides in the field of Six Sigma. And this would really help us as a team.
The Six Sigma journey last 1 year. We had multiple projects cutting across various units within operations. And it has been a learning journey, very smooth, and for all of us, especially me,
on-stream analyzer. I attended this 5-day Six Sigma course, and really it was not only useful to understand what Six Sigma is, but also as a general methodology for process improvement. Many tools I learned through this course, and I'm really sure that I will be able to use these tools in my day-to-day.
Hello everyone, future CPHQ professionals. I just want to give you a bit of an idea of last week course on CPHQ exam preparation. It was awesome. We covered the majority of the topics in a very targeted and focused way that allows us to later on focus our studying and our energy and our time.
I think there's an issue in the audio in the sharing part. That's fine. So with that, I think we can wind up the session.